My name is Dr. Hari Iyer. I'm a hand and upper extremity surgeon, and I work at the Center for Hand and Upper Extremity Surgery. So carpal tunnel syndrome usually affects the sensation to the hand. Oftentimes, patients will come in complaining of numbness and tingling to the thumb, the index finger, the middle finger, and sometimes half of the ring finger. The reason why is because the nerve that supplies the sensation to these fingers is the median nerve, and that nerve sits right here in the palm before it goes out to the fingers. That nerve is covered by a ligament, and that area is called the carpal tunnel. If they leave it alone and they don't do anything or seek medical attention quickly enough, what can end up happening is the muscle mass here in the palm can actually degenerate over time. And you'll often see patients who are in their 80s and who have been dealing with carpal tunnel for their whole lives and never sought attention. They don't have muscle mass here because that nerve's been compressed for so long. The next question becomes, what do we do for carpal tunnel? So for carpal tunnel, there's really 3 different treatment modalities. And they range from the simplest thing that you could possibly do all the way out to surgery. The first thing to do is to buy a carpal tunnel wrist brace. And you can find them online at Amazon, or you could find them at your local pharmacy. The next stage of interventions for carpal tunnel syndrome is a steroid injection. We can apply a steroid injection directly to the carpal tunnel. What that does is it decreases the swelling and decreases the inflammation of that ligament, and that basically increases the space for the nerve. Now that's only a temporary solution. The medication will eventually wear off, and in about 6 months to a year, your symptoms are going to come back. The final treatment option for carpal tunnel syndrome is surgery. Now, surgery for carpal tunnel syndrome is actually one of the best surgeries that you could ever do on the human body because the outcomes are fantastic. Up to 95 to 100% of patients will have complete relief of their symptoms. Additionally, the risk profile for that surgery is very low. The odds of you having a complication are less than 1%. There are 2 different ways you can have the surgery done. You can have the surgery done with an open incision in the palm, which is the traditional way to do it. Basically, it is a 2 to 3 centimeter incision right in the middle of your palm. And what we do is we come down through the skin and we cut that ligament, that tight ligament that sits on top of the tunnel. We cut it and we leave it open. And that allows for a lot more space for the nerve. The nerve has a chance to get replenished blood supply, and it has a chance to heal over time. The other way to do carpal tunnel surgery is to do it endoscopically, which is my preferred method because it's minimally invasive and it allows for a faster recovery time. In order to do it endoscopically, we make a small incision right here. The incision is much smaller. It's about 1 centimeter in size. And I do it in the wrist creases so that it's cosmetically cleaner and heals better with less scar tissue. After making that incision, I use a camera to get into the tunnel. That camera has an attached blade to it, and that blade is used to cut that ligament from the underside and open it up that way. That avoids the pain and the size of the open procedure, the size of the incision. It makes the incision a lot less cumbersome for the patient, a lot easier to manage, and usually the pain profile is a lot better after the surgery.